Today we're going to talk about fall prevention. A fall is unintentionally coming to rest on the ground, floor, or other lower level. A fall is also when a person loses balance and would have fallen if staff did not act to prevent the fall. A fall is also when a person is found on the floor, unless matters suggest otherwise. A fall is when a person falls but is not injured. That's called a fall without injury. Each year, over 1/4 of adults aged 65 and older fall. Falls can result in serious injuries. Head injuries and fractures of the wrist, arm, ankle, and hip are examples. Falls are the main cause of injuries and injury-related deaths in older adults. Fear of falling affects quality of life. Fear of falling limits daily and social activities, which can result in depression, feelings of helplessness, and social isolation. Due to reduced activity, the person becomes weaker, which increases the risk of falling. Some fall risk factors in the care setting include bed height, a bed that's too high or too low for the patient to safely get out of, care equipment that the patient could trip over, cluttered, slippery, or uneven floors, any out-of-place furniture, so furniture is moved and the patient is not anticipating that it was moved, they could fall, poor lighting, a lack of handrails or grab bars, new, strange, or unfamiliar settings, throw rugs that the patient could trip over, wet and slippery bathtubs or showers, an improper fit or use of wheelchairs, walkers, or canes. Some fall risk factors related to the patient. Anyone over 65 years of age is at increased risk for falling. Alcohol use, balance problems, low blood pressure, confusion, and medication side effects also increase the risk of falling. Some medication side effects include confusion or disorientation, poor coordination, diarrhea, dizziness, drowsiness, fainting, orthostatic hypotension, and frequent urination. Orthostatic hypotension is when a person's blood pressure drops when they go to a sitting or standing position. Some other fall risk factors include frequent elimination, vision problems, history of falls, food problems, joint pain or stiffness, poor judgment, pain, sleep problems, weakness, shoes that do not fit properly, and pets that the patient can trip over. Some fall prevention programs are to meet the patient's basic needs. Basic needs include fluid needs, eyeglasses and hearing aids being worn as needed, tasks being explained before and while performing them, help being provided with elimination needs, calming individuals who are agitated, positioning the person properly in the bed, chair, or wheelchair, using the correct procedures and equipment for transfers, having the person being involved in meaningful activities, and exercise programs. Safety in the bathroom and shower tub rooms is also important. With this, tubs or showers have a slip-resistant surface, grab bars are used, and shower chairs are used. Not using throw rugs is important to fall prevention. Having a patient's clothing fit properly. Making sure that the call light is within the person's reach and the person knows how to use it. Frequent rounding or going from patient to patient and checking to see if they need anything. Color-coded fall bracelets. In the hospital, some facilities use a yellow fall wristband just to indicate that the patient is at a high risk for falling. Ensuring that the floors are free of spills and excess furniture, including cords. Using chairs that have armrests. Making sure the bed is at the correct height for the person. Making sure that bed rails are used according to the care plan. Putting a floor cushion down in case the person falls. Using wheel locks. Wheels have locks to prevent the bed from moving. Wheels are locked at all times except when moving the bed. Make sure wheels are locked when giving bedside care and when transferring the person. And finally, making sure that the patient is wearing slip-resistant footwear. Grab bars are in the bathroom and in the shower or tub rooms. They provide support to sit down or get up from the toilet. They are also used when standing in the shower and to get in and out of the shower or tub. This picture here shows a shower chair. This is a fall mat. If the patient were to fall off the bed, they would land on the mat and not on the hardwood floor. On the left side of the screen is a picture of non-skid footwear. And on the right side, you see the yellow bracelet that indicates that the patient is a fall risk. To help prevent falls, position change alarms are used. It's any physical or electronic device that monitors a person's movement and alerts staff of movement. So for instance, there are chair and bed sensor pads, bedside alarm mats, alarms clipped to clothing, seatbelt alarms, and wireless motion sensors. Position change alarms do not include door and elevator alarms to monitor patient wandering. Alarms do not replace close observation. So the one picture shows a chair alarm. So that's an alarm that's placed in the wheelchair or chair, and it will alert the staff if the patient tries to get up. Bed rails are a device that serves as a guard or barrier along the side of the bed. The nurse in the care plan will tell the CNA when to utilize bed rails. They can present a hazard if not used correctly. So when raised, they're hazardous if the person cannot get out of bed. He or she can fall if trying to climb over them. Entrapment is a risk of bed rails. Entrapment is when the person gets caught, trapped, entangled, or strangled in the rails. Bed rails can only be used if needed to treat a medical symptom. They must be in the person's best interest. The person or legal representative must give written consent for bed rails, and the need for bed rails is carefully noted in the person's medical record and care plan. Having all 4 bed rails up on the bed is considered a restraint. Transfer or gait belts are devices applied around the waist and used to support the person who is unsteady or disabled. It helps to prevent falls and injuries. When used to transfer a person, they're called transfer belts. When used to help a person walk, it's called a gait belt. To use these belts, you position the buckle at the back, do not leave excess strap dangling, and remove the belt after the procedure. You need to use caution in patients who have an ostomy, G-tube, COPD, an abdominal or chest wound, or a hernia. Always apply the transfer or gait belt over clothing and around the waist and under the breasts. Never position the belt buckle over the person's spine. If a person starts to fall, bring the person close to your body. Ease him or her to the floor and call the RN to check for injuries. If the CNA finds a person on the floor, do not move the person, call for the RN. You need to report a fall to the appropriate licensed nurse immediately and follow facility protocol. These pictures show how to catch a falling person. So in picture A, the falling person is supported with a gait belt. In picture B, the person's buttocks rest on the nursing assistant's leg. And then in picture C, the person is eased to the floor. Moving the person from the floor. First, the RN will assess the patient for injuries. Per OSHA, minimum manual lifting when possible, so a mechanical lift may be used. And it's important to always use good body mechanics. If a lift is not used, roll the person to his or her side and position a draw sheet. Avoid reaching across the person. Have at least 2 staff members on each side of the person. Bend your knees, not your back. If a lift is used, kneel on one knee, grab the draw sheet, and lift smoothly with your legs as you stand. The Morse Fall Scale is a scale completed by the RN. It's a method used to assess a patient's likelihood of falling. Research has shown that the Morse Fall Scale can identify approximately 78% of patients who are likely to fall. This picture here is a sample Morse Fall Scale. So the RN would go through each of the questions and score it. So if the patient has a history of falling, they would have 25 points. If there's a secondary diagnosis, they would have 15 points. If the patient uses an ambulatory aid, they would have 15 points for crutches, cane, or a walker, 30 points if they hold on to furniture when walking. If the patient has an IV or IV access, they have 20 points. If their gait is weak, 10 points. Impaired, 20 points. And then mental status. If they forget their limitations, it would be 15 points. All of those scores are added up. A low-risk patient will score 0 to 24. A medium-risk patient is 25 to 44. And high risk is anyone who scores 45 or higher.